Now, we are going to start our plenary session of IBBC 2023. This session will be enlightening us with the wonderful talks of speakers. It's a time now, ladies and gentlemen, to introduce our first speaker. She is well known for her excellent work in the field of research. The Dean Faculty of Life Sciences, Government College University, Faisalabad. I consider it a great honor to invite our first speaker, Professor Dr. Farhat Jabeen, on the stage to share valuable knowledge with us. Please give a big hand for Professor Dr. Farhat Jabeen.
In the name of Allah, the most gracious, the most merciful. So I am here to present a very important topic about the brain health. With reference to the theme of the conference, that is the brain health. So we will be discussing here the brain health as we are going to age. What is the effect of the age on the brain when we are moving forward? So this is a nice presentation for all of the levels, being from the simple to the complex one, because being the experts in the physiology, in the psychology, you people are more familiar with the whole mechanisms, which is going to be with the whole neuronal sciences, neurosciences, and the psychology, cognitive behaviors, and all. So as the learning, it is the process of the learn, then unlearn, and then relearn. So we people here are at the stage of relearning, because we have learned at the earlier stages. Now, first thing is the unlearning, and now again it is the relearning. So I have started. So there are the different factors which affect our brain. The brain health can be maintained through the physical activities. It can be maintained through the good food, including the different kinds of vitamins. They may support the heart rate, the healthy food, the mental different kinds of the exercises. They help in building up our cognitive learning by taking the pure water, and then there are sufficient amount of the oxygen. They are always helping us to maintain the healthy brain. So what will happen when we are going to age? So when we are going to age, so good overall health may also have to maintain the good brain health. So we should be in the position to optimize our health. We should optimize the health care. We should take care of our health overall. Now we will discuss that how the aging it will be affected. So the aging well depends on our genes, that is the genetic makeup, or our inheritance, and second is the environment and the lifestyles. So they all are responsible for having our good brain health. So the healthy lifestyle choices may help you maintain a healthy brain and a healthy life. So what will happen when we are going to age? So the age-related changes in the memory and the learning, we may find that increased difficulty in the finding age when we are going to more senior, and then the more problems in the multitasking, and then there could be the mild decreases in ability to pay attention to the different tasks. So we can still learn new things when we are going to age through the practice and by having and adapting the different abilities. Then we can create the new memories, improve the vocabulary and the language skills when we are going to age with the passage of time. So now there are the certain possible risk factors or the threats to the brain health. In general, some medicines are the improper use of the medicines, they can affect the brain health. The smoking, it is the risk factor, and then the excessive use of the alcohol in the modern countries, and then the heart diseases, diabetes, and other health problems like the Alzheimer's and the dementia, poor diet, insufficient sleep, and the lack of the physical activity, little social activity, and being alone. Most of the times, they are also responsible for the brain health. So the medicines, as I have described, it is a risk factor. So the medicines and the brain health, some medicines and the combination of them can affect your thinking brain it will work. So the task which was healthcare are the doctor, or the GP, or the neurologist who is going to treat you about the drugs you take and the possible side effects on the memory, sleep, and the brain functions. Are you getting my points? आप लोगों को आवाज आ रही है then? Yes. Okay. Thank you. So benefits of quitting the smoking at any stage. So lower risk of the heart attacks and the stroke and the nerve diseases, then the better blood circulation and not exposing others to the second-hand smokers or the passive smokers. So we should be advising our friends and the colleagues and the employees and wherever we are working to quit smoking, because it is not good for our brain health, it is not good for our heart health. Alcohols and effects on the brain health, so that it will slow or impair the communication among the brain cells, even with the moderate use. Then poor driving, slurred speed, fuzzy memory, drowsiness, and the dizziness. They are also responsible because of the alcohol use. Then long-term changes to the balance, memory, and emotions, coordinations, and the body temperatures. So, staying away from the alcohol can reverse some of the changes which have been taken place to our brain. So, some medicines can be dangerous when mixed with alcohol. So, we should advise the people to please quit the alcohol, the other things like the cigarettes and something like that. So, the common conditions that affect the brain health, these are the nine different kinds of the diseases as already mentioned. It could be the heart disease, then high blood pressure, then diabetes, Alzheimer's disease, stroke, traumatic brain injury, depression, and the sleep problems. They also have a bad effect on our brain, our memory, and other things. So the heart diseases and the high blood pressure can lead to the stroke and the blood vessel changes related to the dementia. So this is a main risk factor to create the dementia into our population. So how we can reduce the risk? So by controlling the cholesterol and the high blood pressure, the dementia, it can be controlled. So we can perform the physical activities and exercises. We should eat the healthy foods. We should quit smoking and make the little use of the alcohol. So all these they can help it, but the neurodegeneration, once it has happened, it is difficult to cure. But only we can moderate them. The diabetes, they damages the blood vessels throughout your body, including your brain. So increased risk for the stroke and the heart because of the diabetes. So the diabetes, it is a risk factor regarding the brain health, and maintaining a healthy weight through the physical activity and the healthy eating can prevent or control the diabetes. The dementia, so the dementia, it is also responsible for the brain health. So the dementia affects two or more of the following functions of the brain. It causes some memory loss, communication and the language problem, ability to focus and pay attention, reasoning and the judgment, and the visual perception. So the severe enough to interfere with the daily life. So there are certain kinds of the other related factors regarding the dementia. That is the Alzheimer's disease, vascular dementia, could be the Lewy body dementia, mixed dementia, frontoparietal dementia, dementia associated with the Parkinson's disease, and the alcohol-related dementia. So these are the different types of the dementia which could be related to the place of the brain. So these are the different risk factors which can reduce the risk factors for the dementia. It could be present at the birth, it could be at the early stage, it could be the midlife stage, it could be at the late life stages, and out of these 35% it will be responsible for the curable, and the 65% they will be non-revertible. Then the Alzheimer's disease, it is also responsible. So the Alzheimer's is a buildup of the harmful protein in the brain. So it will cause the death of the brain cells and loss of the connections among them. So the Alzheimer's disease, there are no factors on the age when we are going to the more aged, then the smile, it will be going to be the more. The genes, in some people, they are also responsible for having the inheritance patterns, and then the head injury, it could be the responsible to build the Alzheimer's disease. So the suspected risks, they include the heart diseases, high blood pressure, and the mild diet, lack of the physical activity, depressions, and the diabetes. Alzheimer's disease, now the some therapies can treat Alzheimer's symptoms, they don't slow down the disease changes in the brain. So some approaches show the promise in reducing the risk of the cognitive decline of Alzheimer's, but need more testing like exercise may help, then the healthy diet, controlling the high blood pressure, heart disease, diabetes. So these are just like the management practices, and then the cognitive are the brain training. The brain injury is also responsible for the health of the brain. So the oldest adults are at the high risk of the falling and other accidents that can cause the brain injury. So how can we reduce the risk of the brain injury? Exercise to improve the balance and the coordination. Take a fall preventive classes, and then make your home safer. Review the medicines and the visions with your healthcare providers. So we should wear the safety belts and the helmets while we are driving, and we get enough sleep in order to prevent the brain injury due to the fall. Then another important risk factors, it is a depression. So the feeling of the sadness or the loss of the interest in the favored activities that last for the weeks at a time, not a normal part of the aging, and confusion or the attention problems caused by the depression can sometimes look like the dementia. So the treatment can involve the therapy and the medicines. So the caring for your brain in the 4 areas, it could be the physical activity, we should be more active. When the physically, we should have the better diet and nutrition, we should stimulate our cognitive abilities, and then we should remain socially engaged. So the physical activity, so here why we need to move, why we should move, why the physical activity is important. Because the brain has over 1 billion neurons, and the heart beats roughly 120,000 times than our neurons. So the 25% of the blood flow goes to the brain. So what is good for our heart is also good for our brain. So we can increase our heart rate by walking, by running, by dancing, by gardening, by the yoga, the biking, the housework, the lifting weights, and the swimming. That is the different kinds of the activities they are available of your choice, of your interest, by which you can gain your physical activity. You can strengthen yourself, you can make the more cardio exercises to have the circulation of the blood into your heart, which will be ultimately responsible for the health of our brain. So as long as your heart rate is up, so it will keep it going, and our life will be the smooth and the happy. Diet and nutrition is very responsible. We should be very choosy while we are making choice of our food for our healthy life, overall health, as well as the health of the brain and the heart. So we can choose a Mediterranean diet, which is the combination of the lean meat like the fishes, and then there could be the combination of the cereals, combination of the vegetables, and the combination of the different fruits and the water. We can still use the DASH diet, which is the very rich in the potassium, rich in the magnesium, rich in the calcium, and having all these, you can see here that this diet can also help to have a healthy life. So here are the few means I have described at the start of my presentation, that is, learning is all about learning, unlearning, and relearning. So all of us are well known about that what to eat and what not to eat, or what should we avoid. This is just a relearning or recalling that which food it is useful for our health and which is not. So by reducing the nuts, the seeds, the legumes, the beans, and the whole grains, we can improve our overall health. We should use the lean meats and the fish, the fruits, the vegetables, and the olive oil. They will be helpful in having our great health. We should avoid the saturated and the trans fats. We should avoid the processed foods, the foods that are high in the sodium and the sugar, deep fried foods, and unhealthy fast foods. They are not good for the health, overall health, as well as the health of our brain. So we should make certain puzzles or the different kinds of the games in order to stimulate the cognitive behaviors and the cognitive learning. It is very important that we should be working on most of the time with the different games and the puzzles. So they will increase they will stimulate our neurons and they will increase our memory and our learning power. So the ways to stimulate our brains, they could be the many. So we can learn the new languages. So we should read more. We have learned new skills. So by learning a new game, so we can do the words of puzzles, drive a new way or to the home without any GPS, and use other hands to brush the teeth and the hair, embrace the new and the novel experiences. So these are the some. There are so many by which we can increase and we can stimulate our brain having the whole learning. So there should be there are the different ways of the social engagement. Some is that we have to engage our older people with the germs and the energetics in order to have a peace in them and in order to make them happy. So it is very important to have the social engagement like the friends and the different visiting families, visiting friends, joining the book clubs, so the volunteers, starting the game nights and the meet with the neighbors. So nowadays it is a practice generally that we are unaware of our neighbors. We should be very connected with our neighbors. We should make engaged with them. So we can invite them over a cup of tea, or we can go to them, visit them for a cup of tea and chit chat and so many to share the happy moments with them. So we can say while we are in the grocery stores or the medical stores or any other public area, we can say hi to our friends and other colleagues or maybe the students or maybe your relatives one. So we can go to meet the different social meetups in order to remain socially engaged. So now there are the different factors and the simple ways by which we can stimulate the brain health, or we can become happy, or we can love our brain. So it could be the breaks, sweat, that is we should be more involved into the physical activities. So hit the books. So by reading we can improve our learning capacity and we can be happy maybe by feeling the different, finding the different kinds of the interesting stories in the books and by maybe some historical learning whichever you want. So by using the books we can love our brain and we can make it happy. So we can rule out the different kinds of the disease in our life. So we should follow our heart. We should have a good circulation pattern because this good circulation pattern is good for the health of the brain, and lastly we should head self and we should avoid the head injury because it will ultimately not good for our brain. Because if our brain is good, we are working together and we are enjoying our life, we are learning and we are helping the others and we are everything depends upon our health status on the brain. Then we should fuel our diet, that is choose the good nutrition, good diet for ourselves, and then packaging some good things into our life. And so we should take care of our mental health and we should stamp ourselves. We should be using the inspiring things and we should make the links and the connections like the videos or the social engagements. So what we can do, this is a message of today's talk, and what we can do for today, we should do something, that pick one thing you can do that you may help your brain. We have discussed many, that is making the social engagement by making the physical activity, by taking the good meals, food, etc. So think of the small first steps such as taking a 10 minutes walk a few times a day. That is very friends and the community. You can add more. So these are the different kinds which can help us, that is, by adopting the healthy habits, we can make our brain healthy. That is the way a regular sleep, we can take the powerful naps, so we can stay hydrated. We should make a good use of the water. So we can make the different kinds of the sugars and the carbs, they can be cut down, so we can still stay socially engaged. So avoid the drinking alcohol and quitting the smoking, and that stimulate your brains and the keep learning. And we have to stimulate our cognitive learning, so we should take care of our mental health, and overall we can have the different exercises like the yoga and meditations, and we can be thinking about and manage the stress, and we should stay active. We should be have the vitamin D, and we should expose ourselves to the sunlight. So these are just few examples where we can make our brain healthy. So thank you very much for your patience and listening.
Thank you very much, ma'am, for your intellectual talk.